Good morning and welcome everyone. Thank you so much for joining us for this webinar on using behavioural insights to increase the reach and take-up of Family Hub services, findings and lessons learned. It's wonderful to see so many of you here this morning. My name is Huma Haq and I'm the Evidence and Implementation Lead at the National Centre for Family Hubs, hosted by the Anna Freud Centre. Briefly, for anyone who is joining us today for the first time, the National Centre for Family Hubs is an online resource hub and learning network funded by the Department for Education and led by the Anna Freud Centre, the UK's leading evidence-based children's and families' mental health charity. The National Centre is designed to support the development and implementation of family hubs and has to spread the best practice across England, taking into account what families say they need and want, what providers tell us about best practice, and what we know from evidence about what works. Today's webinar is part of a rolling programme of learning events hosted by the National Centre, and recordings and resources from our previous events are available on our website. A link will be put into the chat for you to access our previous learning events. In today's event, we will be exploring the findings from behavioural insights research to support the development and evaluation of interventions designed to promote the uptake of services delivered by family hubs. The slides from today will be shared with you after the webinar. Next month, we have our third national conference coming up on family hubs and integration. This will be our first in-person conference and we're really looking forward to it. The event is fully booked, but you can be added to our waiting list. Again, the link that will be placed in the chat. You can also join our Family Hubs in Mind Learning Network to receive our newsletter, where we'll share details of future learning events and resources. Please click on the link to learn more. Today's event focuses on exploring what works to increase the reach and uptake of family hubs services by families who experience exclusion and barriers. We'll hear about the findings and lessons learned from the behavioural science research studies conducted by Sheffield Hallam University in collaboration with 4 local authorities as part of round 1 of the Department for Education's Family Hub research projects. We are joined by a brilliant lineup of speakers this morning to explore this topic. We are going to start with an introduction to behavioural science from Dr. Abigail Millings. Dr. Millings is from the Centre for Behavioural Science and Applied Psychology at Sheffield Hallam University. We will then move on to a presentation from Dr. Holly Wilcoxon from the Centre for Behavioural Science and Applied Psychology at Sheffield Hallam University on the Sheffield project, which will be followed by reflections from Helen Lomas at the Sheffield City Council. Following this, we will hear from Dr. Daniel Paddock, who is a research associate at the Centre for Behavioural Science and Applied Psychology at Sheffield Hallam University. Dr. Paddock will be sharing insights from the Durham project, and Fiona Smith from Durham County Council will give her reflections from the LA perspective. Dr. Wilcoxon will then present on the Wolverhampton project, and Denise Williams from Wolverhampton Council is here to provide an LA point of view. The final project is the work done in Wakefield, and this is presented by Dr. Elaine Clark from the Centre for Behavioural Science and Applied Psychology at Sheffield Hallam University. We will then be joined by Dr. Millings for conclusions, and I will close the webinar. If you have any questions or comments, please do pop them in the Q&A function, and the speakers will try to answer these as we go through the webinar. Anything we don't get to today, we'll collate as a list of frequently asked questions, which we'll make available on our website. You can also get in touch with us via email, ncfhinquiries@annafreud.org. It's a pleasure to now introduce Dr. Abigail Millings, Project Lead and Associate Professor at Sheffield Hallam University, who is going to provide an introduction to behavioural science.
Okay, so hi, I'm Abby Millings. I'm an Associate Professor at the Centre for Behavioural Science and Applied Psychology at Sheffield Hallam University, and I led the projects in round 1 of applying behavioural science to uptake of family hub services, which is a programme which was funded by the Department for Education. Next slide, please. So in this webinar, we're going to be telling you about how we've applied behavioural science to promoting the uptake uptake of services in 4 different local authority contexts, and that's Sheffield, Durham, Wolverhampton and Wakefield. So today you're going to hear from the lead researcher in each project, and I'm delighted to say that we've also got key representatives from each of those local authorities here to tell you about their plans for using the work moving forwards and their reflections on the work that we did with them. So finally, I'll then finish with some conclusions which draw across the programme of work as a whole. Next slide, please. Okay, so a bit about behavioural science to start off then. Behavioural science encompasses a broad range of psychological models to help explain why people do particular things and why they don't do particular things. And if we can understand why, then we can work out how to encourage change. So the COM-B model, which is this diagram here, proposes that the factors affecting any given behaviour fall into the categories of capability, opportunity, and motivation. So we're going to take the really mundane example of me drinking coffee as a target behaviour to explain this. So capability is whether a person can do the thing. For example, whether they've got the knowledge or skills required. So if I don't know how to use the coffee machine, that's going to be a barrier to me drinking coffee. Opportunity is the extent to which a person is granted the chance to do the thing. For example, this could include environmental factors. So if none of the shops close to where I live sell coffee beans, and let's assume that I haven't heard of instant coffee, I can't exactly make and drink coffee. And that's because I haven't got the opportunity to do so. And then finally, motivation. So these are things that affect the extent to which a person really wants to do the thing. And they can include emotional responses and beliefs about the consequences of the behaviour. And both of these things can be driven by past experiences. So if, for example, I remember that I don't actually like the taste of coffee, and historically I've got a caffeine headache when I've had it, my motivation to have coffee again is going to be quite low. So behavioural science allows us to identify the specific barriers and facilitators that fall into these categories so that we can then target interventions. Importantly, though, we have to choose the interventions guided by certain criteria, and sometimes this means we're selective about which barriers we will and won't attempt to address in a given context. Next slide, please. So the appease criteria are very helpful here. So for any intended intervention, we can weigh up the likely acceptability, practicability, effectiveness, affordability, possible side effects, and equity. And this would help us to choose whether that intervention is appropriate for the context. So here I've highlighted practicability and affordability because they're particularly salient for this current context of working with local authorities and working within family hubs, but also the relatively small scale research projects that we're going to be telling you about today. So by way of an example, if a barrier to engaging with family hub services is a lack of diversity in the workforce, then, and that would lead to underserved communities feeling like those services are not for them, one logical intervention would be to diversify the workforce. This is really important and helpful to identify as a longer term aim, but we also recognise that the practicability and affordability of delivering widespread workforce change and systemic change in the kind of timeframes that we'd be able to evaluate in a fairly small scale project is actually quite low. So in the projects that we're going to be telling you about, we've used behavioural science methods to uncover a range of barriers to engagement with family hub services, some of which we then attempt to tackle directly with interventions, and some of which we recognise as being beyond the scope of small-scale intervention. But we also regard them as really important contextual information and learnings for local authorities moving forwards in their transformation journeys. So in short, behavioural science will tell you where the issues are and what probably needs to change in order to facilitate a given behaviour, whether that's walking through the door of the family hub, attending a session that they're booked on, whatever form of engagement it is with the services that you're interested in. But behavioural science is not a magic wand. It won't fix the impact of systemic problems. So with that preamble and introduction of behavioural science done, I'm now going to hand over to my colleague, Dr. Holly Wilcoxon, who's going to tell you about the project that we did in Sheffield.
Thanks, Abby. Hi, everyone. So in Sheffield, Sheffield City Council had identified that they wanted to engage fathers more with their family centres services. And the particular project that they had in mind was to increase new fathers' engagement with a new dads support group that had been piloted. And they wanted to be able to offer this opportunity to more dads in the area. Next slide, please. So first of all, we started with developing some research questions with Sheffield City Council. And these were broken down into 3 qualitative and 1 quantitative question to explore during the project. So for the qualitative work, we wanted to look at what the actual barriers and facilitators were to new fathers accessing this support group. And so we planned to use the COM-B model that Abby's just described to explore what these main barriers and facilitators would be. We then wanted to develop messaging and to get an understanding of what messaging would be best used to promote the group to new fathers, and also to explore whether social media would be an appropriate mechanism for advertising the group. So these qualitative questions were explored with collaborative workshops with stakeholders, and also through a few qualitative interviews with new dads in the area. And then following this, we took the developed messages into an online survey to conduct a bit of quantitative work to assess whether the messages developed with behavioural science were indeed better received than the typical messaging that had been used. Next slide, please. So we obviously took as our starting point the population of interest, which were new dads in Sheffield who had a baby aged 0 to 6 months old. And the initiative that we were exploring was new communications and improved communications. So as I said, the first step was to conduct workshops with stakeholders and some interviews with dads. And these were used to predominantly identify those barriers and facilitators utilising the COM-B model. So here I've just listed a few of those. A massive barrier that came out was that actually dads in the area just lacked knowledge about this support service, and they weren't aware that there would be a support group for new dads, and obviously that would be a massive barrier to them being able to then access it. Assuming that they did know about the group, or once they knew about it, we were able to explore other barriers, and things that came up were issues such as feeling nervous or embarrassed to attend a support group, being concerned that it might be overly formal or inflexible and might require too much commitment from them or too much cost. But we also explored things that would make them more likely to join a new fathers support group. And here several other factors came out. So for instance, lots of the dads liked the idea of a social and supportive space that was just for them. They liked the thought of something that would be flexible and informal and allow them to relax a bit with other dads. This was just emerging from the full COVID lockdowns, and so there was a strong preference for an in-person group if possible. And there was also a feeling that obviously in the newborn phase there is a lot of focus on mums, and whilst they could all understand why, they did like the idea of a bit of a guilt-free space where they could just be dads and address whatever worries and concerns they had of their own, even if they felt they were maybe not as big as some of the things that mums deal with. So once we had explored a number of barriers and facilitators with the dads, we were able to use this to develop messaging that would target these barriers and boost and promote these facilitators. Next slide, please. And we also wanted to talk with the dads that we interviewed about how an advert might look, and how that could play into the messaging that was observed. And so here we got further information regarding, for instance, the fact that both the textual and image elements could be used to address these barriers and facilitators. So for instance, an image of a dad with another dad could promote that the group was more social. Images of dads relating to their babies, and images focused on dads rather than mums would all promote the fact that this was a dads group and it was a space for them. There was a preference for a positive and supportive message that didn't lean too far towards either mental health support, which was felt to be a separate issue, or too far into humour, so something sort of quite down the middle. They did like use of several images on the advert. This added interest and also was able to promote more of the barriers and facilitators that were discussed. All of the dads we spoke to strongly endorsed the use of quotations on the advert from other dads who had already been involved with the group. And this was a really good way of promoting the benefits of the group and reducing possible worries or nerves about going along to something like that. And then as well, any clarity pertaining to the financial cost and the accessibility of the group was also favoured. So taking all of this into account, 2 adverts were drafted up informed by this behavioural science that would address the feedback and include messaging and imagery that we'd already discussed with dads. And these were then compared to standard messaging that Sheffield used in the online survey. Next slide, please. Now, obviously, the final report that we produced does go into a lot more detail about all of this. But here you can see briefly some of the results of that survey. Along the bottom here are the 3 messages that we compared. So the first one on the left of the screen is using standard messaging that Sheffield already utilised. We did put on an image akin to the ones we used in the behavioural science messages as well, just so that the image wasn't the only kind of factor that stood out for them. And then the 2 messages, the middle and the far right, were the behavioural science informed messages. And you can see on the bar charts that the 2 messages informed by behavioural science were preferred by the dads and were more likely to make them want to join the new dads support group. Next slide, please. So the favourite message was behavioural science message 1. And this one, for instance, did address key barriers. It was very much focused towards dads. It highlighted that it was not a weakness to ask for help. It put dads in the middle of the message. It showed the flexibility of the group and the fact that it had no cost involved. And as you can see, it incorporated several different images to promote things like the dad's bond with his child, the fact that he might be struggling a bit, and the fact that he could meet other dads and have a social benefit from attending this group. Next slide, please. Overall, we found that the adverts that were informed by behavioural science performed better than the standard advertisement material. They were more liked, they were felt to use clearer language, they included more appealing imagery and more clarity about whether the group cost money and how to access it. In particular, having seen behavioural message 1, which is the one on the slide here, dads reported that they felt more knowledgeable about the new fathers support group and what it was. They felt that they would meet other fathers similar to them. They felt it would be a safe place to share positive and negative experiences as a dad. They were more likely to respond yes about leaving their email address to get further information about the group. And they were more likely to agree with the statement that they wouldn't feel nervous or embarrassed to join the group. These were really nice, clear findings, and we therefore were able to recommend proceeding that Sheffield roll out with the support group and use the advertisement posters that were informed by behavioural science when advertising it. And I think this is where I hand over to Helen, who can tell a bit about the LA's experience. Thank you.
Thanks, Holly. Hi, everybody. Yeah, just 5 minutes really, just to reflect on what Holly's been talking about that happened for us in Sheffield, and really enables us now to look at that further rollout of dads groups, which this last 6 months have been successful. We've used a lot of the research outcomes around the particularly using that behavioural message 1. And we've now got that focused approach really to look at how we can engage dads in new groups that we are facilitating and looking at developing after that piece of research. And we're very much focused in our approach to include the way we do engage fathers as well as other parents, women and co-parents and so on, in our new communications plan. So the service ensures really that we continue to highlight throughout any engagement the key messages that Holly's discussed already in the slides. And, you know, in particular looking at the facts to reduce stigma and increase ability to get involved. You know, so looking at the social benefit for involvement, giving that positive, supportive message out there. And for us in Sheffield as well, we have had the ability to look at that new focus with our Family Hub and Start for Life funding. We're looking at that Dads Matters communication in general, and we're looking to commission a project looking at engaging with dads. And we will be following on from the research around how we actually engage fathers in this new commission moving forward. And we also look at all the teams or the existing teams, ensuring that we follow through on those consistent online posts. I think that's the message for us quite clearly about being consistent and looking at highlighting the key messages for fathers' engagements as we move on. Next slide. So what's next for Sheffield? Well, we've kind of moved further with having that social interaction with fathers. We've started to implement some more social groups, and we will be using the research outcomes to make those engagement posters to hopefully engage, further consult around new groups, and enable us to publish our offer using the research methods, which will enable that combination of online resource and face-to-face groups, posters, advertisements. So you can see to the side of this slide, through the consultation and the research that we've done this last 6 months, you can see that actually what dads are asking for are, you know, that social interaction, and they've come up with a number of key names around dads and kids out and about, who let the dads out. You know, this has come from fathers themselves about what they feel will be interactive and engaging to fathers to proceed to be part of those groups. And yeah, it's something that we're going to continue to develop and make sure that we use that research outcome with regards to engaging fathers and making those posters engaging, as Holly has explained. And yeah, the ongoing development for us and reflection of what's happened over this last year for us is helping us to establish new groups, and those new groups will be developed by fathers involved. And we will have that further consultation moving forward. So it's been a really useful piece of work for us in Sheffield. And yeah, thank you for all of that work that Sheffield Hallam did. And I'm now going to hand over, I believe, to Danielle Paddock.
Thanks, Helen. Hi, everyone. I'm one of the researchers at Sheffield Hallam University, and I'm now going to talk through some of the findings from the project with Durham County Council. So next slide, please. So for Durham, these are the research questions and methodology that were the focus of this evaluation. We had 3 qualitative research questions. So unlike the other projects, this one was entirely qualitative. And the initiative for Durham was to have more father-inclusive advertising for parenting support, specifically designed to promote uptake by fathers of young people aged 11 to 16 years. So that is particularly the age group that this project targets. So our research questions were interested in what are the barriers and facilitators to fathers of children aged 11 to 16 engaging in parenting programmes? What messaging should be used in communication strategies to promote parenting programmes to fathers of children aged 11 to 16? And finally, which messages are most effective in promoting the facilitators and overcoming those barriers for that particular group? Next slide, please. So as I previously mentioned, the methodology here is purely qualitative, and the project was split into 2 phases. So in phase 1, we started out with behavioural science workshops with stakeholders, but also with some Durham dads, which really started to explore the barriers and facilitators to uptake, and also what messaging could and should look like. So this phase aimed to address some of research question 1 and 2. And then phase 2 involved the qualitative interviews, which aimed to address research question 1 and 2 in more detail, following on from that first phase, and the third research question. So in this phase, 20 interviews were conducted by community explorers and research staff. So we interviewed fathers aged between 30 to 59 years old, and all fathers had a child aged between 11 to 16 years. So 2 fathers were recruited through community explorers, and they did the interviews, and the remaining 18 fathers were recruited through Durham City Council and QA Research Consultancy, and these were conducted by Sheffield research staff. So today I'm going to talk more about the findings from phase 2, the qualitative interviews, and give you a brief overview of what we found. So for more detail about phase 1 and for more in-depth detail about the findings that I talked through today, please have a look at the published report. Next slide, please. So overall, the interview data corroborated the barriers and facilitators identified in the phase 1 co-design, and also generated some additional barriers and facilitators that fathers face. So analysing this using the Combi model, in terms of capability, the majority of fathers we interviewed reported a complete lack of knowledge about the existence of family centres in Durham, and also a lack of knowledge about the services that family centres could provide. And there was also a lot of uncertainty about whether the services were suitable for them, with many dads suggesting that there was discomfort about attending family services, as these groups are usually dominated by women in their perspective. And although that lack of knowledge about family centres did act as a barrier, many fathers also suggested that having the psychological capability and skills to actually access services was a facilitator. So fathers talked about how they were confident in their ability to initiate contact if they really needed to. So then in terms of opportunity, fathers suggested that support or signposting from a linked organisation was a facilitator, and that was also how fathers had previously accessed the support. So for example, their child's school initiated the contact with the family centre, suggesting that could be a valuable way of building awareness in the future. And they also discussed how a flexible delivery service would facilitate their engagement with family services, for example, having options of online or face-to-face services, as that was easier to fit into their schedule. When that is not an option, the lack of or the cost of transport, and also a need for having evening or weekend services, was a barrier to fathers' uptake of these services. And then finally, in terms of their motivation, dads were very non-judgmental about others who had accessed support, believing that good parents know when to seek help, but simultaneously hoped not to ever be in that position themselves, and took great pride in not needing outside support. So that pride can also act as a barrier to engagement. And also the role of dad was also seen as somewhat different to mums, and some dads suggested that this was reflected in the services available to them. So some of these perspectives were established when children were younger, with the perception that these types of groups or services are targeted for women, and that left some dads feeling self-conscious or out of place at family services, so were less likely to engage. Next slide, please. So during the interview, we also showed fathers the 6 advertisements that were co-designed during phase 1 to ask about their views and to see whether they overcome any of the previously mentioned barriers. So I've included examples of 3 adverts on the slides, but all 6 can be found in the report, and fathers' opinions on the individual advertisements can also be found in the full report. But overall, across the 6 adverts, there were some common themes. So fathers really liked how the adverts emphasised that the services were free, and liked the fact that there were various ways to contact the service, including a phone number and a website link. Fathers also liked how the messages created a positive perception of family centre services, which was encouraging for them. However, on the flip side, some fathers would prefer some clarity on the adverts, for example, including availability of services to increase accessibility. And also concerns were raised about how a person would be unlikely to remember the contact details if they saw this advert in passing or while scrolling through social media. So maybe a QR code would make this more memorable. And also the inclusivity of images, so making sure there wasn't too many images, but also making sure there was enough that represented a range of family dynamics. And fathers would also prefer some clarification on the specific services that were being offered through family centre services. So overall, we didn't necessarily find that there was one advert that was sufficient enough to address all of the perspectives and information needs of all fathers. And from the findings, it is clear that fathers face potentially a number of barriers and facilitators to accessing family centre services, which cannot be addressed by a single advert due to the range of information needed and also different individual preferences in terms of content and tone. Next slide, please. However, there were some features of the current advertisements that do address certain barriers and facilitators for fathers. So, for example, some barriers and facilitators were addressed via the information included on the adverts. So providing the right information can address some of the barriers and facilitators associated with capability, such as that lack of knowledge and awareness, and also the opportunity, such as clearly showing that the services are free, and also that services can be delivered either online or in person. Some barriers and facilitators could also be addressed through the placement of these adverts, for example, by addressing barriers associated with opportunity, by placing these adverts in organisations such as schools or GP surgeries. Fathers highlighted the importance of other related and trusted organisations as a source of information, and referral. So placing adverts in these locations may promote this and facilitate fathers' engagement. And finally, barriers and facilitators can also be addressed through the choice of images on the advert. So the choice and use of images was likely to address barriers relating to motivation. So images that include dad as well as mum reinforce messages that family centre services are for dads as well as mums. And also using images that show positive imagery can reinforce the idea that family centre services are likely to result in positive outcomes, depending on how that is interpreted by the individual. Next slide, please. So to conclude the findings from the Durham project, I'm just going to end on some recommendations. So although not all barriers and facilitators can be addressed through the advertising, there are some recommendations for the advertisements. So they should consider, firstly, the number of images used. So recommend using 2 to 3 images so that the images include different family groups and dynamics, so fathers feel represented. Have information to highlight the accessibility of services. So consider including opening times of services or phone lines, along with that clarification of costs, i.e. that the service is free. Use QR codes so that target groups can capture the contact details this way. Have some options to contact Family Centre in a variety of ways, whether this is on the phone, website, or in person. And finally, messages to have the details about the specific services that are offered through Family Centre services. So overall, the recommendation would be to create a selection of adverts that do address some of the barriers and facilitators, but also accompany these along with identifiable branding that could showcase the flexibility and range of support services available for fathers. So thank you for listening. I will now hand over to Fiona to talk through some of the reflections from Durham County Council.
Thanks very much, Danielle. I hope you can all hear me. Apologies in advance in case I do repeat some of the findings that Danielle has shared. But from a Durham perspective, I've got to say that the research structure and process has been extremely insightful. And listening to Durham dads and male carers firsthand about the barriers and facilitators related to that COM-B model has been hugely helpful. It did, however, reiterate the challenge that we continue to face about changing that cultural perception of dads and male carers and their parenting role. So we knew, however, that this research was only going to be the tip of the iceberg as to what we need to do better to engage dads and male carers in all family support work. So the research findings are extremely useful, with some very tangible recommendations that we can take forward and, like I've said, scale up in all of our communications. Now, we intend to use in Durham the recommendations as a bit of a checklist to help in the development and presentation of messaging. And like Danielle said, with everything, not one size fits all, and even the findings themselves identified that no single message would appeal to everyone. However, that being said, there are some very practical tips, some relating to directly the messaging of comms and market materials, and some more general about that service design, which would inevitably provide more opportunities for dads to engage. So just some key findings which we are taking forward and which we hope to take forward are that absolute necessity to, where services are free, advertising them as so. I think with the cost of living crisis at the moment, that's a real huge point that we need to emphasise in our adverts. Highlighting the accessibility of services, and Danielle's mentioned about having, time, date, location, whether it's a face-to-face or an online service, but very much the perception that often there's lots of waiting lists. So if there is a case whereby your service, your support offer can be accessed quite quickly, then we need to kind of say that as well. I've already mentioned about phone numbers, websites and QR codes, and about having the range of options to be able to find out some more information, and very much around emphasising where support services can be accessed outside of that usual Monday to Friday 9 to 5 offer, particularly in relation to dads who say one of the barriers is the current service design that is available through the family centres. Portraying a very positive perception rather than the perception that you only access support if there's a problem. And I think obviously with the whole family hub agenda, very much bringing back that universal offer, it really enables us to do this now, and encouraging people to make contact before family issues do reach that crisis point. Very much using kind of that learned experiences from other service users and directly using quotes from other groups and in case studies about the support which they've received. And we mentioned about using a number of different images so that different family groups can be represented and to ensure that the messages remain relevant to our intended audience. What was really quite a light bulb moment for us was around the ensuring that the images and the text and messaging actually align. So for example, if you had a very positive image in kind of an advert, then we need to make sure that we do not use text which talks around challenges of being a parent, and instead use positive language to match positive images and vice versa. In positive imagery itself, where people have young people and parents expressing positive body language as opposed to kind of conflict or negative emotions, can also reinforce the idea that our family centre services are likely to result in positive outcomes. Again, something which we had never thought of was around even the accessibility of groups within our family centres, about promoting when services can be accessed confidentially. That came across in our Durham findings, and particularly for our Durham dads, the absolute necessity to promote on social media sites as well, because that's likely where they will actually see adverts. So we have shared our findings and met with our comms and marketing team, our web design team, design and print, who often, if we kind of ask them to do a job for us, they will create some imagery, for example, and in some text to go alongside, and also our social media team to make sure that within Durham, all that need to know are fully briefed in this. So far, we've begun to promote service offers that will meet the needs of parents rather than promoting the service provider. So, for example, what your needs are and how we can meet them rather than who we are and what we do. And that's been a kind of a real turning point for us. We've already started to look at ways of messaging for out of hours. So where we actually aren't around, on an evening or weekend, although we are designing our services so that we are much more accessible, we are looking at kind of answer phone facilities, or being able to direct to the website for more information, or where people can leave an answer phone message that can go kind of to a shared inbox. That is something we are taking forward. When there is the budget to do so, we are hoping to have large social media campaigns to really enable that variety of different imagery to be used, depicting different family makeups and targeting and speaking to the diverse range of families which we do have in Durham. Obviously, where we are only able to have one image for whatever reason, we will make sure it is diverse as possible and appropriate. We need to be much better at promoting on a range of social media sites which supports the findings, as more likely that dads and male carers are going to access that social media. And I think it's really important that the recommendations, are excellent, but we need to kind of, I suppose, pick and choose depending on what the need and the target audience is, and find a balance where appropriate of what to use. So, for example, you wouldn't necessarily use QR codes on a social media post, but you would within posters, etc. So we wouldn't want to bombard marketing materials with just too much information, because that can kind of put people off. But having the facility to link to more detail will really incorporate many of the recommendations that will be appropriate. We do provide in Durham schools and educational colleagues with information and images to promote services which they can directly kind of lift and cut and paste into their own websites, their social media posts, and in their newsletters. And we do this in Durham by having a termly early help newsletter, which is targeted at schools and education colleagues. And as the findings have suggested, that families are much more kind of receptive where information on services is promoted through partner services such as schools. So that's something which we will continue to take forward. I would say less likely from some of the findings, if you do have a chance to read the full report, that we would want all of our partner services to have the same branding. I don't think that's something we would be able to get away with, but I definitely think we can use our partners as those vehicles to get those key messages out there and have that real positive perception of seeking support. So through our dad's work, we have started to offer more activity and educational based sessions, again, which is what the the findings within the research suggested. That would be more engaging for dads, rather than just feeling that the family centres is somewhere to come when there's a problem or there's an issue or they need help. By engaging them and getting through the door through kind of educational activity based sessions, we are much more likely to be able to support dads in accessing future support as needed. And we've done that through kind of mission session activities about upcycling misuse bikes, for example. And also our schools have also started to take on some of these key findings and having kind of baking in buddy sessions for dads to get them more engaged within the kind of education and school life of their children. So we have still got an incredibly long way to go, but it is really encouraging to know that Durham has already started to implement some of the recommendations, and we're really excited at the opportunity that these findings will bring for Durham going forward. So thank you very much, Sheffield Hallam. I'm now going to pass back over to Holly. Thank you.
Thanks, Fiona. So yes, I'm now going to talk about the third project within this body of work, and this is the one with City of Wolverhampton Council. We're moving away now from the DADS research and into a slightly different topic. Next slide, please. So in Wolverhampton, there was a real interest in exploring how local families of non-white British heritage and who had English as a second language could experience outreach activities designed to promote the Family Hub's services on offer. And there was a desire to explore the barriers and facilitators faced by these families to engaging with the Family Hub services, and Wolverhampton wanted to see whether the outreach activities that they were planning to use would promote motivation and reduce a sense of stigma related to using Family Hub's services. And then following this, there was a hope to conduct some quantitative work to explore whether the outreach activities resulted in higher numbers of families using these services. So in this presentation today, I'm going to focus on the qualitative work and what we did to explore these barriers with the families in the area of non-white British heritage. So next slide, please. So the interest was predominantly on families who had a child aged 0 to 6 and who had English as a second language. And Wolverhampton had designed a programme of taster sessions in community settings to take some of the family hubs services and the knowledge of these out into the communities where these families were more likely to see them. They had designed quite a comprehensive programme of taster sessions. Unfortunately, these were interrupted by COVID at the time, and so the programme that we ended up with was slightly reduced down to specific taster sessions of certain classes that they might be able to experience. But other aspects of the outreach work did have to be sidelined at the time, and you can read a bit more about that in the report. However, we still got some great findings. We conducted 2 focus groups with women from the area. One was with women who had Arabic as a first language, and we also had a translator with them. And the other group was with women who had Punjabi as their first language, and again, we had a translator for that. And we explored with them how they experienced the taster sessions that were provided in the community and how this would impact them and their thoughts about the Family Hub services more broadly. So we conducted a thematic analysis of the focus group transcriptions, and we used, again, the COM-B model that Abby went over in the introductory slides. So next slide, please. So here I'll just go through some of the key barriers and facilitators that came across in these focus groups. So in terms of capability, there was a big lack of knowledge about the services amongst this group. They weren't aware of particularly the content or the availability of some of the classes. And it was found that the taster sessions were really good at addressing this lack of knowledge. The women who attended felt that they had a much better understanding after attending these taster sessions of what the Family Hub services provided and the fact that these services could be for them. They also realised that they were relevant to people who we classed as similar others, so non-British families in the area and even migrants and asylum seekers. So the taster sessions were really positively received in that regard. Next slide, please. In terms of opportunity, several things came across. So the lack of accessible information was a big one. There was a need for different sources of information and availability of this information in their own first language if possible. Now, obviously, like many local authorities, there are a number of different first languages that people in these areas have, but I think it kind of reflected that where possible, and certainly if there are groups, large groups of certain languages that are spoken, it is preferable to have information that's accessible to those groups in their own language. And in a similar vein, not having translation services at Family Hub services themselves did come out as a barrier for some. Predominantly in Wolverhampton, it was the Arabic speaking group that requested this more. The Punjabi group were less bothered by this. Interestingly, they felt that some of these services, particularly the English classes, but that these were a good chance to practice their English in a supportive environment. Struggles due to locations of services were mentioned, and costs of public transport. So accessibility did come up as a big issue for this group, and therefore it shows that the outreach work as well and going to these communities in their own areas is a real positive in that regard. Pragmatics such as clashes with other commitments on time. So classes that are on at the same time as school runs, for instance, particularly where there might be issues and people might be relying on public transport. So real careful thinking of other issues that these families might be facing in terms of providing services at times that they can get to and places that they can get to easily. A massive facilitator in terms of opportunity was word of mouth. So within these communities, knowing just one other person even who had positively engaged with these services was a massive boost, and people really valued seeing someone like them who had used the service and found it beneficial. So campaigns sort of promoting word of mouth and getting the message out in the community are likely to be successful. Next slide, please. Finally, we explored motivation. Interestingly, although the local authority had wanted to particularly address how to reduce stigma, what came across in the focus groups was that actually these groups didn't see that there was stigma in using Family Hub services. They didn't seem to care what others thought about them attending the family hubs, and in fact they had quite positive views of the kind of services being offered. So in fact stigma doesn't seem to be a barrier for this group, at least in Wolverhampton. And a massive motivational cause for these women was a desire to improve their language skills and to feel a bit more integrated with the local community and the wider community. And family hubs were seen as a place that might be promotive of that as well. Next slide, please. So the recommendations for Wolverhampton were to continue increasing the knowledge that this target group has about the services that are offered and the fact that those services are for them. In doing this, they need to ensure that that information is accessible. So where possible, providing appropriate translations and also putting this information in places that the target group will see it. The services themselves need to be accessible. So they need to be held at convenient times of day. They need to be in venues that this target group can easily reach and that don't have severe cost implications for them. And it's always wise to consider having translators present at sessions where possible, in a way that will kind of boost participation for groups that may feel that they need that. Where possible, this community seemed to respond well to being invited directly. So reaching out with specific invites so that they know that they are included. And within this regard, it did seem pertinent to continue offering taster sessions, which did seem to be a great sort of gateway into the Family Hub services. And then also to consider implementing the wider outreach activities as had been originally planned before COVID kind of got in the way. And more information about this is in the report. I believe that's where I hand over now to Denise. Thanks.
I'm Denise Williams, Partnership Manager in Wolverhampton. So we do have some similar findings to others who we've already heard from today in Wolverhampton. Things such as providing information in different formats and around accessibility of services. But the barriers experienced by non-English speaking communities in Wolverhampton, we saw were further exacerbated by language differences and a consequent lack of knowledge about the services that we provide from our existing hubs. So what we've taken from the research is that we need to increase knowledge and understanding. And in terms of that, we need to be reaching out more to non-English speaking communities and plan to use and utilise behavioural insights in developing our communications strategy. But that communication strategy must include, as Holly has said, word of mouth, provision of taster sessions, as well as including positive, inclusive images of the communities we serve in our publicity materials. And more widely, we've built the following actions into our delivery plans for family hubs. So, ensuring that our family hub workforce reflects the cultures and languages spoken in Wolverhampton. So not merely through the use of translation, but ensuring that we do have staff within our family hubs that reflect our communities and are able to communicate directly with them. Utilising the multicultural and multi-language skill of staff within the hub network to support communication and consultation with local communities. So within the wider hub network, in terms of the centres and services where we provided outreach activities, ensuring that they are part of that wider communication network for non-English speaking families, and that we are using those as some of our outreach centres for family hub services. To ensure that communities feel included and are included in the development of our family hub services, we will ensure that our parent and carer panels are reflective of the diverse backgrounds of families in our communities, so that we're working together to co-produce the local offer and ensuring that it's inclusive and sensitive to cultural needs. And that is also about that kind of two-way process of communities understanding what our offer is, but us also understanding what their needs and wants are from family hub services. Additionally, the recruitment of parent champions from within minoritized communities, particularly around that reaching into and having direct conversations with, having direct life experience and experience of our hub services that can be shared within the communities. Next slide, please. And that will then enable us to provide different services as required, or the same services in a different way. So, for example, one of the taster sessions that was provided was a parenting session that had been translated into Arabic, and I know that the parents said how much they valued that session. And that will ensure that communities know about the services that are available, as well as I mentioned, through virtual and physical taster sessions, as well as a published offer. And data collection, oversight and aggregation needing to be used to ensure that we understand who does and doesn't use our family hubs, and how we can ensure those with protected characteristics are not discriminated against, and targeted action can be taken where necessary, so that our services are tailored to meet the needs of the whole community. In terms of the taster sessions and the research during the period of the research project, we do have some parents that have continued to access the services from the hubs following those taster sessions. We have parents and carers who've been recruited to our panels, and we have one parent who's expressed an interest in becoming a parent champion. So it really does show that when you reach out and offer that service and support in a different way, the take-up is there. Thank you. I'm now going to hand over to Elaine Clark.
So I'm going to talk about research that we did in this round with Wakefield Local Authority. And to give some background, in Wakefield, the transition from children's centres to family hubs began in January 2021. The local authority was keen to promote awareness of the new remit of family hubs so that families of school-aged children could access services when they needed them. Next slide, please. So the aim of this piece of research was to evaluate a new communications strategy implemented in schools designed to promote awareness of family hub services to families of school-aged children. The communications being piloted aimed to promote family hubs interventions and the team around the school delivery model. In this model, multi-agency professionals work collaboratively to support families, with the school situated as the focal point for access. At the time of this research, the new communications strategy was being piloted in 4 primary schools and 2 secondary schools within Wakefield in advance of being rolled out across the district. These pilot schools were supported in the phased release of information about family hub services and were provided with content to embed in their school websites. The materials used were leaflets, posters, a video and promotional materials such as bags and water bottles that were provided to children at the schools. And we will share the link to the video in the chat for those who are interested. Thank you, I can see that's come up. To evaluate this communication strategy, we carried out interviews with parents and staff at the 4 pilot primary schools and parents from 3 similar primary schools where the communication strategy had not yet been rolled out. All of the parents we spoke to were women. They were between the ages of 24 and 51, and they had between 1 and 4 children. The 3 members of staff were from 3 different schools and had each worked in schools for between 3 and 15 years. We carried out a thematic analysis of the interview transcripts using the COM-B model of behaviour change. I'd like to note that as part of this project, we also looked at the routinely collected data from the service around self-referrals and intervention uptake. I'm not going to talk about this in the project today, in the talk today, but if you are interested, you can find all the details in our published report. Next slide, please. So these are the research questions we addressed in the qualitative part of the project. Our first 3 research questions were about whether the new communication strategy increased parents' awareness of family hub services, whether it reduced a sense of stigma around them, and whether it promoted parents' motivation regarding family hub services. And we addressed these using qualitative interviews with parents. Research question 4 was about how school staff experienced implementing the new communication strategy, and we addressed this using interviews with staff. Next slide, please. I'm going to talk about the most important capability, opportunity and motivation factors linked to engaging with family hub services, including team around the school support, that we identified in this research. Namely, these were having knowledge about family hub services themselves, beliefs about accessing these services, previous experiences of seeking support, emotions about seeking support, and social norms. We compared responses from the parents from the pilot versus the non-pilot schools to tease out the possible effects of the communication strategy. Next slide, please. From our analysis, we found that most parents had some awareness of family hubs or children's centres, but there was a lot of uncertainty about exactly what services were available, who they were for, and what they were called. However, parents from the pilot schools were all aware that they could approach their child's school for support, while this was not the case for the non-pilot school parents. For example, this parent from one of the pilot schools said, "They are always making parents aware that if we need help or anything, that we can contact the school." Regarding opportunity factors, parents did not report a sense of stigma about accessing family support, either from their own experiences or thinking about others. One parent said, "I think if people need to use it, I think it's a great idea." There appeared to be social norms for accessing baby groups and services, but less so for accessing services for families with older children. That is, parents tended to know people who had been to services for preschool children run by the children's centres, but didn't tend to know people who had been to the family hubs with their school-aged children. And this may fit in with the transition to family hubs being relatively recent at the time of the research. Next slide, please. Parents generally believe that if they asked for help from a family hub or their child's school, they would receive help, support, or advice. And most said they would do this should the need arise, as shown by the parent who said, I probably would get in touch with the family hub if I did feel like I needed that extra support. However, parents' previous experiences of seeking support appeared to influence their confidence about how helpful this would be, as parents who had had difficult experiences in the past, even with other services, such as the NHS or third sector organisations, were less confident about the benefits of seeking support. Some parents were unsure who they had sought help from in the past, and this linked in with the uncertainty about the support that was currently available from family hubs and the team around the school. The staff interviewees felt strongly that, based on their experiences of supporting families to access further help, negative emotions about seeking support could be major barriers. One member of staff said, it's a hard step and you have to really trust somebody to make that. In particular, staff highlighted a sense of shame about perceiving oneself as being inadequate as a parent and the fear of instigating contact with services that might result in their children being taken away from them. By contrast, parents tended not to talk about negative emotions connected with seeking family support unless they had lived experience of this, as shown in this example. I actually went through for a few years scared to open up to people thinking, will they take my children off me if they know that my child's getting me so down and upset? This suggests that there is a gap between anticipated and experienced emotions about seeking family support. That is, asking for help as a parent may feel harder than people expect it to. Next slide, please. Overall, from this research, we were able to say that the new communication strategy appeared to have had a positive effect. Parents from the pilot schools had greater awareness that school can be a source of support for families and were more likely to cite their child's school as the source of this knowledge compared to parents from the non-pilot schools. Staff were also positive about having the communication strategy materials and structure provided. We were therefore able to recommend that in order to reach the families of school-aged children, schools should be provided with materials, support and reminders to promote family hub services and team around the school support, as per the Wakefield Pilot Communications Initiative. Our research also highlighted that parents may not understand or remember jargon, including the names of services, or understand and remember details about how different services work, such as how they fit together or how they differ from each other. We suggest that messages to parents need to balance being simple and being specific. The example shown here, if you're worried about your child, then ask at the school office about getting help from the team around the school, uses an if-then plan that includes a scenario that can be recognised by parents being worried about their child and tells them exactly what to do to access support and what the name of the service is. This type of message should help parents know how to get family support should the need arise. Next slide, please. Our research confirmed that increasing awareness of family hub services in local communities is an important first step for promoting engagement with families. Remote communications, such as the leaflets, poster, video, and website content used in the pilot communication strategy, can be valuable for this, but cannot address all barriers to family engagement, and so other approaches are also needed to complement this approach. Outreach work may be useful, such as having family hubs workers present in schools at formal or informal events so that parents can talk to them. One of the non-pilot schools in this project had held such events. For example, the family hubs workers had spoken at a school event for parents and had also had a stall at the school's usual fundraising event. These outreach events did seem to improve parents' motivation to engage with family hub services. Our research highlighted the need for building trusting relationships with families in advance of support being needed, but this obviously requires investment in terms of staff time, whether this is school staff or staff from the family hubs themselves. However, without this type of trusting relationship, It may be extremely difficult for some families to engage with the support that is available through family hubs. Thank you. I'm now going to hand over to Anne-Marie, who will give some reflections from Wakefield.
Thank you very much. For some reason, I cannot get my camera to work. So I'm Anne-Marie Spencer, Service Manager for Strategy and Transformation. Just building on the information that Elaine has provided in our research project, this was always a programme that we wanted to roll out to every Wakefield school. The research has really helped us to understand better what has worked and those areas that we need to reinforce, strengthen, and to continue to develop as part of our ongoing programme. So we have set ourselves a target that in 2023, 65% of schools will have adopted this communication strategies, and in 24, 85% of Wakefield schools. Our aim is to ensure that families recognise the branding, the Wakefield Families Together, which we have adopted across all of our communications alongside our partner organisations, and to help families to recognise where they can go for that early help when they need it most. The communication with schools is key to our strategy going forward. We, as Elaine set out, have provided schools with both website and social media content that they can adapt for their parents and the messages that are important to the parents, whilst keeping that core bank of information around what is provided within their geographical cluster area of the Wakefield district. The team around the school is a key programme for us. We have an early help link worker in every school across the district, and helping parents to access services at that earliest point. The learning from the research is that by doing more interventions on the school site, working with schools to ensure that those messages are consistent and drip fed, we'll hope to reach those parents at that moment in time when they need the services, and can then access that when it's most important to them. And I think that's probably key, that we do lots of communication, but if it's not at that time when the parent needs that support, they do not always remember where they can go and how they can access it. So the key theme is to speak to their school. Their school will then make that contact with professionals through the team around the school and be able to have those conversations to ensure parents get the support they need. I think that we all use case studies and quotes from parents in promotional material, but I think again it's trying to ensure that the messages correlate to the different needs that parents may have before they reach that crisis point, and to really stress and reinforce that these services are free, they are easily accessible, and where those local family hubs are located, so that parents can either go directly through their school for support or walk into a family hub and ask for that support themselves. So I suppose that key message is about that drip feeding. We want to destigmatise asking for help. And if we can do that in a way that ensures that it's equitable and accessible across all of our communities in Wakefield, then we will start to see that increase and uptake by families to access interventions. The service and the benefits of those services, I think we're very good at telling what we provide. Less so, we don't always explain what the benefits of accessing that service will bring for the family and their children and partners. And also that linked in to ensuring that those messages are consistently available in all of our promotional material, so that it does help families to make that connection into that future action that we need to see when they feel they're ready to take up the support that's available. And this research has really helped us to start to build on some of the learning, to take that forward in our plans to roll out the full communication over the next 2 years. So thank you very much. I'm going to hand back to Abby.
Okay, so now you've heard about all 4 projects, and we've talked about behavioural science informed messaging for fathers in Sheffield and Durham. We've evaluated the success of these using both qualitative and quantitative methods. We've also talked about the mode of delivery of information in the communication strategy piloted in Wakefield, where schools are essentially the messenger for a wide range of linked services. And we've also heard about community outreach in the form of taster sessions in Wolverhampton. So I want to step back now and draw some conclusions across the projects, and you can find further information on all our recommendations in the full report on gov.uk. The link is already in the chat, and just to say that link in the chat will actually take you to 3 reports. One is the full report of our findings, that's the longest one. Another is a summary report of the recommendations specifically. And then the other report at that link details all of the methodologies that we used in these projects. So if you're interested in the kind of research protocol side of things, I would suggest you look at that report first. Okay, so just stepping back then, I think we can usefully consider this question of what do people need in order to engage with Family Hub services in light of the capability, opportunity and motivation model of behaviour. Thinking about capability first, so the most basic issue seems to be, coming from all the projects, knowledge. So in order to engage with Family Hub services, people need to know that Family Hub services exist. I mean, it sounds pretty basic when you put it like that, but they also need to know what Family Hub services do. And without that knowledge, they don't have the psychological capability to engage. People also need to have the opportunity to engage with the services that are offered. And the factors that have come up across multiple projects here is that these services need to be free and they need to be accessible. And without that, people don't have the opportunity to engage. Finally, motivation. So freely accessible services that everybody knows about are a great starting point. But if people don't want to go and use those services, then they won't. And in order to want to be motivated to engage with services, people need to understand how they will benefit. They need to have the confidence to ask for help early on, and they need to perceive the services, and the services are made up of their staff, as trustworthy. So some of these things can and should be addressed via messaging, but it's really important to remember that messaging is not going to solve everything. It won't change people's prior experiences with services, or occasions where they didn't feel listened to, or occasions where they have noticed that they're not well represented by the staff profile. And I think some of the barriers drawn out in the projects we've heard about today highlight the broader systemic changes needed that could begin to tackle some of those things on a longer term basis. Next slide, please. Generally though, if we think about messaging, thinking about accessibility and thinking about people's motivation to engage, we can summarise some of our broad brush recommendations as follows. So behavioural science informed messaging campaigns should be used to advertise Family Hub services, and they should do this widely and prominently. Information needs to be available in a variety of formats and languages, and it needs to be available at the places where parents are likely to look for it. And we know from the research that we've done that this is online, this is social media, this is trusted organisations, and perhaps underutilised by word of mouth through informal social networks. And this is perhaps where some of the outreach can come into play. Advertising needs to make it clear that services are free. People won't know that if you don't tell them. Family Hub's promotion needs to give parents positive expectations about engaging with services to take away some of the fear. And local authorities should promote public understanding of the role of early help in preventing crises. But this is a really interesting one that's come up in some of our some of the interviews across projects, is that people think that the services are not for them because they're not at crisis points. And obviously this is kind of undermining the entire point of early help. So we need to make people more aware of what early help is for, and that you're supposed to get it early to prevent a crisis. Family hub services need to be offered in locations that are accessible to all, but without incurring transport costs. So as I've said, all of the work that we've talked about today is detailed in the reports that have been published on gov.uk, and the links have been provided in the chat. Next slide, please. So at SEBSAP, we've supported multiple local authorities to apply behavioural science across a range of different behavioural domains, and this includes uptake of family hub services. And what we and the local authorities that we've worked with tend to find is that behavioural science really is an invaluable tool for understanding why people do and don't do certain things, and for supporting change in people's behaviours via targeted interventions. If you'd like to know more, we would be very happy to hear from you. Feel free to get in touch. Thank you very much to all our speakers today, and thank you for listening. And I am going to hand back now. Thank you.
So I just want to say a big thank you to all of our speakers for a really interesting session. Thanks to our audience as well for taking the time to join us today and for sharing your questions. Also, a massive thank you to our amazing training team who work very hard behind the scenes. So that's to Rachel, Jo and Paula. Please do read the report shared in the chat for further insights. At the end of the webinar, you'll be redirected to a survey form. Please do fill this out. We really appreciate it, and all feedback will be used to shape our upcoming webinars. And just a reminder to sign up to our Family Hubs in Mind Learning Network to receive our newsletter. The link will be provided in the chat. Thank you, and see you again soon.